Shoot.
Hey everyone, how's it going? Man, today we have an amazing guest who I'm absolutely in awe of. Over his 40 plus year career, he's been a past president of the American Academy of Cosmetic Dentistry, a diplomat of the ICOI, a graduate of the Mish Institute, and I just think he's an overall nice guy. He's a popular poster on the Pacific Implant Academy and the OC Idea Facebook pages. And this guy is one of the original OGs of implant dentistry, of implantology. I'd like to welcome you all to share Dr. Daniel Mayeda's story. And welcome to the show, Dan. How you doing?
Thank you, Nekky. Aloha. Can you hear me?
I
Can you hear
can I
me?
can hear you well, man. It looks like you got some nice you got a nice tan from the sun. You living in Hawaii for all those years, hey?
Yeah, I went out for a run and,
Yeah.
picked up this tan just for you, man.
Oh, I
Yeah,
like it. I like
yeah.
it.
Well,
You know,
yep,
I
yes.
want the people to learn about you. Like share your history, where you live, who you are, and how you got here. Share your story, my friend.
Cool, cool. Yeah, before I jump into that, I really like to thank you, Nekky, for giving me this opportunity to spend time with you and your members. Because, I watch you guys on Bites and Begin, with Mark and Bernard and the whole gang, Albert, and it's so nice to be a part of your life now. So I want to thank you for
Oh
inviting me.
no, the
Like I
pleasure's
told you,
all
man,
ours.
it's like I got this email. I went like, wow, man, this guy wants me to be on his show, man.
Well,
So
dude, you're
I'm
the
stoked.
OG of implantology. This is the least I can do.
Yeah,
This is
the
awesome.
old, the old gold, the old
No,
gold,
no,
right?
no, no, no.
Yeah.
That's
So
awesome, man.
anyway, you know, in this global society now, um,
Yeah.
I'd like to say that um, in the old days, they used to describe me as this 6 foot, 165, brown haired, gray eyed guy, but
Yeah.
I'm a fourth generation Japanese American, born and
Okay.
raised in Hawaii. Yeah. So my grandparents were laborers. We're all immigrants, except unless you're Native American,
Right.
we're all immigrants. And in honor of Hamilton, man, it's cool, man. That's what this country is about. So
Yeah.
that's the most political I'm going to get about this this subject. But that's who I am, man. It's just me, and I've had the privilege of going away to school. First in Iowa, then Denver. Went to UMKC Dental School before I started my practice back in Hawaii. There's this lure about Hawaii, isn't there, Nikki? Like
Oh, you
poke.
know,
You know,
the lure for me is Foodland. If you've ever been to
yes,
Hawaii, you go to Foodland, you get a big tub of poke, and then you sit on the beach and you eat poke all day. And that's my lure to Hawaii. And then you go snorkeling. But I don't know how you
yeah.
practice in Hawaii. I'd want to go, chasing turtles in the afternoon. I'm sure that's the tourist answer. But do you still get to enjoy Hawaii? Like living there as
You know,
as a dentist, do you still get the same feeling for Hawaii we do as tourists?
I do. I do. On weekends, I'm a tennis player,
Okay.
and early in the mornings, I work out with a personal trainer before I go to work. And I've cut my work that week down to like 3 days a week. Uh, I'll work 10, 12-hour days.
Oh,
If I got a
really?
surgery, oh, hell yes, man. If I
Man,
got a
you are a
patient who,
badass, man. Good for you.
yeah, and I've got, my surgical assistant Esther has been with me for 41 years. I trained her when she was 19. She's like 60 something now,
What?
and she tells me where to place implants. Like, you know, Nikki, and this goes to all of our members here,
Yeah.
that if a patient has a 3 unit bridge from say number 4 to number 6, and number 6 is decayed, uh, heck, I'm gonna take an pre-op impression. I'm going to take that bridge off. I'm going to place an implant in the number 5 position. Extract number 6. Place an implant in number 6. Do immediate load if it fits the criteria. So that's the kind of things that excite me, and Esther
Dang,
will just
man.
stay with me until we're done. I've still got the passion after all
Yeah.
these years. Yeah.
How many years have you been a dentist?
I graduated from dental school in 1976,
Yeah.
and I did a 1 year externship in pediatrics in Honolulu. In the meantime, I knew I wanted to set my practice up on Maui,
Yeah.
and I had a indirect connection on Maui. So I got an architect. Had the office design. I ordered all of my equipment and supplies. I had worked in the dental office while I was in dental school, so I was kind of oriented on private practice, and so I just went for it. I started my practice in '77, and the ICOI had its World Congress on Maui in 1982. I don't know what made me go to it. I went to it, and Carl Misch was there, and Lin Kao was there, and all these old guys were there, and I said, I think I'm going to do this. This is like my type of thing to do,
So that's how
and
you jumped into implants.
that's how I jumped into implants. And at that time, I I searched for continuing education courses.
Yeah.
And as you can well imagine, in those days, when Brandemark came stateside, uh, GPs, I'm a general practitioner, GPs were were not allowed to take Brandemark's course, only
Really?
specialists, yeah, prosthodontists,
Whoa.
periodontists, and oral surgeons. And Northwestern was a teaching institute, one of their teaching centers. Uh, they denied me. They said, you're a GP. But uh, Jerry Nisnik at that time, that's a name from past. By the way, those of you who don't know Jerry, he he took Brandemark on in like 1985
Yeah.
head on. Yeah. And he started teaching institutes in Encino. And I went to three of his courses. He and Risa, his lovely wife, embraced me. And so whenever we traveled to Munich or Beverly Hills, they always uh, mentored me, so to speak, which
Really?
is important. Yeah. And
Yeah.
so he trained me, and I did my first implant 4 years after my first continuing education course. I was like nervous. I knew I
Yeah.
wanted to do it, but like I'm not just gonna jump into it. So
Yeah.
finally, in 1989, I researched different teaching institutes. I had met Carl Misch a few times, and he said, I'm going to learn from this guy. So I committed my next 2 years flying back and forth to Dearborn, Michigan. Carl trained me,
Really?
and yes, and that was like the best early investment, education investment I made in my life. And in the meantime, I attended ICOI courses, symposiums and AID. They were really big annual meetings, regional meetings.
Yeah.
I just love being around like-minded, uh, like-minded people.
Do you find that
Especially
tough
in the
living in Hawaii because you don't like it's not as easy for you to go to a course because you have to go to the mainland. Do you find that difficult or no?
well, when you have the mindset that you want to learn something, you just do it,
Yeah,
and that's what I did. Yeah, I
I
just
hear
did
you.
it.
I got a
Yeah,
huge amount
and
of respect for you because back in the 80s when you were trained, GPs like us were blacklisted. Like you said, you
yes,
can't even go and take a course. Like
mhm.
that didn't deter you at all. Like you never had the thought that maybe you didn't know enough. Like how did you get over that?
No, I'm fearless because I was fearless because I knew at that time oral surgeons were learning implants the way I was learning it. They
Yeah,
didn't learn it in their residencies. It
yeah,
wasn't that popular at that time. So what happened was when I graduated from the Mish Institute in '91, my name all of a sudden appeared on the Brown and Mark OK list, surgical slash prosthodontic list, and I took a lot of heat for that. Uh,
really.
yeah, yeah, yeah. Uh, and so the Brown and Mark people said, "Well, just let Mayeda place his implants. He can restore them, as long as he doesn't place them for anybody else." And so, yeah, that's my story on
Huh.
that. But then
Man, that's so
soon,
cool.
then soon after that, all these other companies like 3i and Stereos,
Yeah.
and Jury's screw vent became popular. They were starting to offer courses, and I took their courses, and that's the that's the early starting in my
That's
implant
man,
years.
that's so cool how
Yeah.
you like, were
Oh,
able to get into that, old boy club. What are you
yeah.
gonna say?
Yes. Yeah.
Yeah.
I have to. I was fearless,
Yeah.
and this is a lesson for new dentists. Hang around people that you admire and you feel can mentor you. Don't try to break into their circle. Just be friendly with them, and if they let you into the Jacari window of comfort, you go and embrace it. So even Dr. Ron Goldstein, the father of aesthetic dentistry in
Yeah.
Atlanta, he took me under his wings, and he told me, Dan, any lecture opportunities you have, small or big, take it and publish a paper at least every 6 months, for your visibility. Um,
Hmm. No,
yeah, so
I
when you hang around guys like you and Mark and Bernard, like you just go so big, you get into the culture of that. So that leads me to say that if you're entering the world of implant dentistry, don't just dabble in it. Go
huh.
all in, and your whole life changes. Yeah,
Man, I
for the
really
good.
I like that. Yeah, but you're totally right. It like our mindset is all based on the people that we hang around. And if we
Yeah.
want to grow, we do hang around with people, that may have bigger shoes than us that we eventually want to be able to fill, right? Um, can you
Hmm.
talk to me about the evolution of the mindset of an implant dentist, in the 80s
Yeah.
to 2021, like 40 years later? Like how has the mentality changed?
The mentality has changed where those those of us who entered the world of implants, GPs,
Yeah.
were renegades, so to
Yeah.
speak, because we just felt that we could do it. Um, we also knew our limits. I didn't do any full mouth rehabs. I believe the first 10 cases I did was mandibular overdentures, and I placed
Those
those
are your first
implants.
cases.
That my first 10 cases
Was overdentures. Okay.
overdentures because the mandible, anterior mandible, is the most predictable place and
Right.
has the best quality bone. And of course, we used to bury the implants for six months, and
Yeah.
you know put a bar clip over it or do a like a locator over it. But yeah, so I did extremely predictable cases, and
Yeah.
not until I went through Carl's continuum, his program from '89 to '91, did I do my first single tooth implant. Yeah, I took it
Really.
very slowly. The
Yeah.
curve was like this. Today you guys can go like this. Like,
Yeah.
okay, go back to your office and do an immediate implant placement.
But do you
Right after
think that's
extraction.
do you think that's all because of CBCTs and the change in implant design though? Like do you feel like with the like adoption of CBCTs across our entire industry, that has really opened the doors? Like when you say you replace an overdenture, like implants for overdentures, that scares me without CBCT. Like I wouldn't even know where to begin. Did you find that or what do you think?
Okay, so what I did, this is going to blow you away. I got these occlusal X-rays about this big,
Okay.
put it on the side of the patient's mouth, and did a side shot of it. So I got a
Ah,
cross section of the anterior mandible. And of course, we laid full flaps, full thickness flaps, buccal and lingual, because of the concavity of
absolutely.
that lingual mental area there. So it didn't scare me, and uh, I did it, very carefully. You know,
Yeah.
yeah, like
Man, that's
like
still, I got huge props to you for that. Like, because you don't really know what you're getting into until you actually get in the mouth, until you lay that
yes,
flap. Like, man, especially on those lower mandible areas, like some of those ridges can be super, super thin and they look big just on the outset, but then when you carve them back, they're
Exactly.
not, right? So,
Exactly.
man, kudos to you.
So, Nikki, since you mentioned the advent of the CBCT, that actually changed my life. I bought my first CBCT in the year 2000. No, excuse me, 2009.
Oh,
Up to
really?
that point, yeah, yes, because I was already 30 years into my practice, right? And
Yeah.
to spend $150,000 on the CBCT was, people thought I was crazy. I had a successful cosmetic and implant practice already, and for
Yeah.
me to spend that amount. But I thought, if I'm gonna go further in the world of implant dentistry, I need a CBCT in my office. Of course, I used to outsource the pre-treatment
Right.
CBCT and then
Yeah.
treatment kind of from there. But with the in-office CBCT, I take a pre-treatment for diagnosis.
Yeah.
As soon as I place the implants in there, the patient is escorted to the CBCT. We take a CBCT immediately post-op. If the
Mm.
patient is just too sedated, we don't. We have the patient come back for a week, and I just pray that I'm not too deep into the sinus, or I haven't perfed anything, you know. But yes, the CBCT has contributed to
Absolutely.
the yeah, yeah, the imp- opportunity for implants to be done
Yeah.
by GPs. Since you brought that up, I was very involved with the CERIC doctors in Scottsdale. I
Oh, yeah.
just
Yeah.
love Puri and all those guys down there. And my only, it's not an objection, Dr. Puri, is that they made placing an implant so simple. You know, just take a CBCT,
Yeah.
scan the mouth, would take diagnostic casts, and then make a guide and place your implant. And and I know, and all of our colleagues know, it ain't that easy, man.
No, man.
Because I've perfed with the guide.
Yeah.
Even after 10,000 implants, I've perfed with the guide when I
Totally.
just thought, oh, yeah, it's a slam dunk. And so I just worry about dentists getting into the world of implant dentistry and not learning proper anatomy, how to lay a full thickness flap,
Yeah. It's the
and just
basics. You got to learn the basics. You got to learn analog freehand version before you jump into guided. I
yeah.
think that's
And I would
we
rather
totally
drive
both agree.
a Porsche, like manual shift rather than a Tiptronic.
Yeah, yeah, yeah. I hear that.
Yeah,
I
yeah,
hear that. Man, that's all. But I have to ask. I hear it in your voice, man. You have this incredible passion for dentistry. You've been a dentist for over 40 years. Like I'm looking at my career. I've been out for 13 years. There's days where I wish I'd just bury my head in the sand. Then there's days where I'm on top of the world. And you've had 40 years of these cycles. What fuels you?
yeah.
Like how do you stay so passionate about our job?
What fuels me is that I've surrounded myself with like-minded dentists in the
Yeah.
world of not only implants but cosmetic dentistry. Uh, Also, uh, I've had opportunities to teach,
Mm-hmm.
from dental assisting programs at the local college to I was director of an AAGD program for recent graduates uh, on Maui. It was the Lutheran Medical Center uh, AAGD program they had on Maui campus, and I
Yeah.
got 4 residents every year. They went on to become oral surgeons, endodontists, GPs, restorative dentists. But that really fueled me to be able to teach. Also, um, just doing the best for my patients, and I'll get local and regional about this, but we have cane fields and sugar cane fields
Yeah.
and pineapple fields, and a lot of those patients are immigrants, like say from the Philippines.
Yeah.
Uh, they have good insurance, not bad insurance, maybe 2,000 a year, but they all have implants in my practice. I don't look at them and say, Mr. So and so, you just deserve a partial because you can't afford it. I tell
Right.
them, this is the best treatment for you, and I am going to stage your treatment. You won't be paying me double. I'm just going to be taking it along, and in 2 years you'll be completed. And to me, that fuels me to see these patients who never value their teeth now value their teeth, not have to wear a removable partial denture. As you know, Nekky, removable partial dentures are only 50% successful.
Yeah.
Patients
I'd
just
say
wear them
lower.
when
Yeah.
you,
Yeah.
yes, yeah. So, of course, having an implant is a bigger investment,
Right.
but its success rate is much higher, I
Oh,
believe. Yeah.
absolutely. But like what I'm
Mhm.
hearing from you is, you hang around with like-minded like dentists and my best friend Ho Young Chung. I call him every day just to learn from him because my hands are, meat hooks compared to his. Like he's really good. I learned from Mark, I learned from Bernard. But it sounds like you've created this like patient-centered practice. And I've always heard these terms like patient-centered
Mhm.
practice, and I think I have one, but
Yes.
how did you do this in 1977? You built your practice and you wanted to create a patient-centered practice. I hear it kind of bits and pieces from you. Like, what does that mean to you, and how did you do that?
Yes. Patient-centered practice to me is a practice where I listen to the patient's needs. I don't rush into treatment, and I explain. I'm a master of redundancy, and I explain things over and over again.
Yeah,
And I, I, I hold consultations with my patients. So, say if a new patient comes in with no specific needs but just
yeah,
wants a dentist,
sure,
we take the records, the hygiene checks, and then gives me a written note. We never do it verbally. So the hygienist, gives me a note, and I continue the conversation with what treatment we're going to propose for the patient. And I inform the patient, uh, you have I'm glad you're here today. Thank you for coming in. I always thank my patients during
okay,
and after the procedures. Because remember, Nekky, if there's if we don't have a patient in the chair, we can't do the work. So
that's
we have
right.
to be thankful to our patients. So I tell the patient,
I like that.
I
I
need
like that.
I need one more X-ray, and I need to take a few more impressions or molds so I can just properly diagnose and give you the correct treatment. And I want to meet with you next week for an hour. There's no charge for it. And I personally do my own consultations because patients want to talk to the doc, believe it or not. Now, if you have a super office manager, more power to you. That's
Yeah.
great. Yeah, that's great. But uh, I've been told by various marketing gurus that, man, if you can hold a consultation yourself, that's that's even more powerful because the patient knows that like just right eye to eye with you,
Yeah.
and get it from you. And then sometimes the appointment coordinator or the office manager, and I know some really great ones, can can offer option B or C to
Yeah.
the patient. But coming from the doctor, I think is more powerful. At least in my office, it has been very powerful. And towards the ending of the consultation, the patient just kind of looks at me with a gaze. They just gaze at me and go, "Can we start next week?" You know,
Yeah.
even before I tell them how much it is. You know,
Yeah. No, I like that. So you
yeah.
do all your own consults. You spend an hour with them. I think that's incredible. Let me tell you a little story.
Hmm. Yes.
Man, I'm going bald. I don't know if you can see it there. I'm losing my hair. And I was like, man, I'm too young. I can't lose my hair yet. So I went to like a hair restoration clinic, like, where they
Hmm.
take, I haven't done it yet,
Yes.
but I was
Yeah.
meeting with the doctor and he met with me for, 30 seconds. Hey, you need this many grafts. Peace out. And I was like, that was it. You're totally right.
Mhm.
I never even, as soon as I, went to that appointment, everything changed for my office. Like my consults all of a sudden became all about me, just like they are all about you, because you're right. We want to visit the doctor. We don't care about their staff as much as we care about the doctor because we're doing the work. So that resonates with me. I hear that. And I like that you spend so much time with them. Are you taking models on every patient?
About 50, depends. If it's
Yeah.
just if the patient has a beautiful dentition with great occlusion and just needs small restorations, I don't.
Yeah.
I admit I don't. Yeah,
No. Yeah,
but
no, I
but
don't, I
if
definitely don't
yeah,
either.
yeah,
No.
yes, and if a patient has existing root canals or implants, I and even if it's not indicated for me to do the procedures, I take a CBCT.
Yeah.
Yeah, because
That's a good call.
that's the power of having a CBCT in your office. And uh, sometimes I it depends how I like the patients. That's why I I love dentistry so much. It's free enterprise for us. I might just charge them for a panoramic X-ray, $150 instead of
Yeah.
$400. You know, because
Oh
all it
man.
is. In fact, my assistant said, "Doc, I just have to switch this, from panoramic view to
Yeah.
CBCT, and you
Yeah.
gain so much more information." And what what I like to emphasize to doctors who look at a piece of equipment as a money making tool, don't do that.
Yeah.
Just look at it as something where you can just give you more information so you can provide better dentistry.
I
Yeah,
like that. You're
that's
taking
that's
the
my
the,
gig. That's,
the opposite approach that every sales team member will give
yeah,
you. So,
yeah, yeah, yeah.
no,
If you buy the CBCT for 65K and you take two a day at $400, that's $800 times 20. It'll self pay for it. Well,
yeah,
that's not my gig. That's my
I,
gig. But
I
if the
respect that.
patient, yeah, if a patient is uh, appears to be a challenge, not really red flag, but just kind of like between green
Yeah,
and
yeah,
and yellow flag, I'll charge them. I'll charge them
yeah.
uh,
No,
350 and
hey,
350.
speaking of that, like, how do you deal with? And I want to learn your way of doing this. Like, how do you deal with difficult patients? Patients that aren't quite listening to you. They're, I don't know. You're getting the red flags, like you said, red flag patient. How do you deal with those patients?
Okay, so are these patients that you've done work on and they don't like what you
Yeah,
did or
yeah,
something goes wrong?
yeah.
Yes.
Some went
So
wrong. Complication. They're not happy.
yes. So you'll get a note on your desk, or your office manager will come and say, "Yeah, Dr. Jamal, Mrs. Smith just called and she's pissed. She thinks
Yeah,
you suck." You know, and uh, one thing you don't want to do is tell your office manager, call the patient back and make an appointment. You call the patient back.
yeah,
Don't get defensive uh, or offensive. Just call the patient, Mrs. Smith. Hi, this is Dr. Jamal, and I understand you have concerns with the work done in this office. Please come in. Please come in tomorrow. And I'd like to discuss this with you to see how we can deal with this for you.
yeah,
Uh, I've mentored a handful of dentists using this method, and where say uh, the doc hit the inferior alveolar nerve and it's numb or this
yeah,
shocking pain going. Um, I've I've mentored these doctors and tell them have the patient come in like every week, call them every other day, see how they're doing, tell them you're taking notes and you're researching why this
yeah,
happened, um, so we can find a solution for it. So uh, the latest case like this was just last week, where a doc called me 2 weeks ago and said, "Oh, Dan, the patient's numb, but she's getting better every day, but now she's getting shocking pains." And I said, "Well, okay, uh, take another CBCT. Don't lie to the patient. Show show the X-ray to the patient. Tell the patient,
Yeah.
the implant is close to the implant. Implant is close to the nerve. Um, we can take the implant out. You offer solutions." And
Hmm.
uh, fast forward 2 weeks, the doctor called me up. He said, "Dan, the patient's not numb anymore." And the patient looked at the doc and said, "Doc, I'm glad I'm not numb anymore. But the most important thing about this whole thing is you cared and you did something about it."
Yeah.
Now, if you get one where you reach an impasse, Nekky, man, I am the first one to refund the patient
Yeah.
and tell the patient, "We'll find solutions for you, but it's not working. What I did for you, I feel I did everything. I use this word with the highest integrity for you. It didn't come out the way we planned it to come out. And I'm refunding you your entire amount." Why the entire amount? Some docs may say, "Oh my gosh, I spent 300 on an implant. It took up 3 hours of chair time." Patients don't care about that.
They
In
don't
fact,
know.
yeah, they don't. That's your problem, man. Your problem. But I found, fortunately, I've only had to do this like 3 or 4 times my entire career. We give you your entire whatever you paid us, and
Yeah.
we'll waive whatever you haven't paid us. Um, I'm going to refer you. I always try to make a referral to, like, say, an oral surgeon or something, or a prosthodontist. Uh, Refer you to this Dr. Smith, and if you'd like to, that that doctor can keep me in the loop. Uh, but we need to end. The best thing is end our doctor-patient relationship. And a lot of times, when they have the money, they get the
Yeah.
money back. You sever the relationship. You never hear from them. I've
Yeah.
I've never heard from them.
It's funny
How
how it
about you?
comes always comes down to money. No matter how
Yes, yeah,
much a situation is, it's so easy to just resolve the situation just by giving a refund. Hey.
yeah. And but don't blow the patient off. You got
Yeah.
to be serious every step of the way, that you care. Because if you just say, "Oh, okay, you paid me 5,000 for this. Okay, here's a check. Go see somebody else." Um, like, you don't care. Like, get the hell out of here type
Yeah.
attitude. That doesn't work. Yeah, that can agitate them even more. Yeah,
Totally.
so they need to sign off that they have received this amount, and
Yeah.
they agree that the doctor-patient relationship is ending at this point. Yeah. So did I answer your question?
Yeah, I think that's one
Kind
of the most valuable lessons, I've only been a dentist for 13 years. That's one of the most valuable lessons I've learned is exactly what you just said. You can't pretend to care. You have to care. And if you don't care, you're in the wrong job. But also
Yes.
if something doesn't go your way, and not everything is going to go your way, it's okay to let the
Yes.
patient
Yes.
know, like it's okay, and it's so easy to resolve the situation by just writing a check right back to that patient for what they paid you. But you have to care, and that totally hits home to me. I'm so happy you said that, because I think new dentists starting out need to hear stuff like that, because we're not perfect. What advice do you have for new grads?
Let me look at my notes. My wife is a branding and PR executive, so she says you got to be prepared for everything. Well, okay, I'll just right off the top of my head here that surround yourself with like-minded people.
Yeah.
Um, to the point of, if your young colleague friends say, "Oh, like, you know, dentistry sucks. You know, I shouldn't be in it." Just kind of separate yourself from them, because, Nekky, and I know you kind of feel this. We have the best profession in the
Oh,
world.
without a doubt, best
Oh,
profession. I love it.
Yes, my my brother my brother's a physician. My son's a physician. Um, I have three uncles who are dentists, and a couple other uncles are physicians, and the dentists are the happiest guys. We're the happiest guys,
But I
right?
find like dentistry comes and goes in waves for me. Like I find I'm on top of the world and then I'm bottom of the barrel. Like do you
Okay,
ever
what
feel
takes
that
you
way?
to no? What takes you to the bottom of the barrel?
I don't know, like, something doesn't work out. Like you said,
Yes,
you put the
yeah,
implant in, you're not happy with the angle and you're like, oh man, like,
yes,
your immediate comes a little bit more facial than you want it to be. And you're like, oh, is this even going
yes,
to work? And then the patient's unhappy because, you get some recession and
right.
like we
Yep.
all have that, right?
Yes, yes, yeah. We
Yeah.
get we get hard on ourselves. Or an example: tooth number 19, 10 millimeter wide ridge, and
Yeah.
you want to put a 5 millimeter wide implant in there. Everything goes perfect, and there's inflammation, idiopathic. I
Yeah.
call it idiopathic inflammation, and yeah, we just and this didn't just didn't come to me. It took me decades to develop this. Okay, yeah, Mr. Smith. Uh, yeah, the gums look inflamed because I check all of my patients in 1 week post-op, and
Okay.
I expect all of my patients to tell me I have no pain, really,
Yeah.
except for maybe the gums might be a little irritated.
Right.
And I just tell them, I'm going to check it next week. I take a PA and I tell them, I'm going to check it next week. And if it still looks like this, I am taking the implant out at no charge to you. I'm going to clean the tissue your tissue that didn't heal.
Yeah.
Uh, we'll, we'll let the bone heal for 3 months. I don't say couple or maybe 6 months. I say 3 months,
Yeah.
and then I will replace the implant at no charge for you. Now, if there's no inflammation when I remove the implant, say if I put a 4.0 implant in there and I remove the implant and there's no granulomatous tissue or infection in there, I will just lightly prepare with my last drill
Yeah.
and I will place a 4.5er in there.
Right.
And if I have room to go a millimeter or 1.5, uh, 1.5 millimeter deeper,
Yeah.
I'll do that.
Just get
Yeah,
stability. No, I like
and it
that. But
takes.
yeah. And I like how you always say, like, at no charge to you, I'm going to do this,
Yes,
because
yeah,
that's so important, right? No, I
yes.
really like that.
Nikki, I didn't make that up. Yeah, about 2 weeks ago, I got this email about an American Dental Association webinar. It was just an hour. It was so well orchestrated on dealing with difficult patients.
Mm. Okay.
And
Yeah.
and the expert said, always mention to the patient that there'll be no charge to you.
Yeah.
And if we can't resolve this, you get a refund. They constantly have to hear that. And you know, it's so what's the word? Not trite or to say, oh, it's only money. Well, we're in it to make money, but sometimes you got to cut your losses,
You do.
and because it's just gonna agonize you, to have to practice hierodontics. Things don't work out.
No.
Life happens. Yeah,
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 life happens. No, I hear that,
yeah,
but I find when I get a streak of something not happening, I'm bottom of the barrel, and I feel like that's when I experience, like, burnout that has become so
yes,
popular the last, couple of years. We're all talking about mental health, we're talking about imposter syndrome, we're talking about burnout. Have you ever experienced burnout? Like, has that ever
yes,
happened to you?
yes. About the seventh year in my practice, at that time I was still running a drill and fill practice,
Yeah.
and
So you're
seeing
running.
40 patients a
Yeah,
day.
you're
Was
running
running
between
these days,
hygiene and three columns
right?
full of patients. I hear that. Yeah.
Right. Yes. And uh, it wasn't for greed. I can say it wasn't for greed. Patients wanted to see me. I worked from 8 to 8, and I was young. I was like in my early 30s, so that was cool. So I could do it. But I woke up one morning and I couldn't move. So I called my office manager and said, just cancel my patients for the next, 2 weeks. I
Oh,
can't work. Yeah,
yeah.
yeah, 2 weeks.
Wow.
Now I have to create context. 30 years ago, to be closed for 2 weeks was much easier than it is today to close for a week.
Yeah.
Yeah,
I'm
yeah,
I'm thinking
yeah.
there's no way I could close for 2 days, let alone 2
No,
weeks, man.
no, yes, yeah. That's why I want to create that context for you.
Yeah.
That
So
um,
how did
yeah.
you get yourself out of that? Like what had to change?
Well, I made reservations at this exclusive resort in Kona. It's called the Kona Village
Yeah.
Resort. They pick you up at the airport and they drive you there. You don't even check in. You go to your hale, your house, and
Yeah.
it's on a modified American plan. Breakfast, lunch, and dinner. No TVs, no telephones. Just you can go fishing. You can play tennis. You can go swimming,
Yeah.
or just sleep. Just
And
not
you
have
just
to think
zoned
about.
out, eh? Fair enough.
Yeah, and this was before the days of the cell phone too.
Yeah.
So that helped. Now it's like
Totally.
not.
I think honestly, I think the cause of a lot of burnout is this. Is your cell
Mhm.
phone always being connected and always being
Yes,
available? Like it's impossible
yes,
to escape your phone. Like it's attached to my hand almost. You know what I mean? And
that's
I
right.
think that's led to burnout for a lot of people. You agree?
Yes, yes. You get like when I receive a text from you at 4 in the morning Hawaii time, I reply to you.
I like it. I like it. Sorry, time change.
Yeah,
No,
but so
yeah, technology is definitely a it's a it's a benefit, but it's also a curse. But in dentistry too, I find it really interesting that you were like you're so surgically driven, but yet you were the president of the American Academy of Cosmetic Dentistry. I'm having a tough time marrying the both, like both those, because you can't pay me to do a veneer on someone. I don't even know what cement to use. It stresses me out. But yet, I'll take out someone's wisdom teeth and feel like I'm daydreaming the
mhm.
whole time because it's just second nature. You know what I mean? Um, how did you like get so good at different parts of dentistry?
Well, just those two parts, just the two
Still, that's
parts of
huge.
dentistry. I
Like
was,
when you
I
say
was
you dive in head first. You're president of both these things. Like, how did you do that?
yes. Well, I've always been interested in aesthetic dentistry. So even in dental school, when my classmates used to put a class 3 in for me, and they said, "Okay, Dan, you're done," and I go, "No, I can see the margin." You
Yeah,
know,
yeah, yeah. I'm not done.
I'm not done yet, but this one's canted this way. So I've always had an eye and appreciation for aesthetic dentistry, and uh, the AACD was in its infancy in the early '80s or late '70s, and I got involved with them. Most of them were like-minded people,
Yeah.
and I would be politically incorrect by saying a lot of wannabes want to jump on the bandwagon.
Yeah.
Just grab the teas, take the mold, send it to the lab, get your serenades from Denmark made, have them in and slap them. And but I enjoyed being that. That became my village, my what's the other word for village? Like my tribe.
Yeah,
That
yeah,
was my
yeah.
tribe.
Yeah.
So I like they came from Toronto, New York City, the Washington D.C., Beverly Hills, uh, and since again this is a safe environment and we live in a global world,
Right.
I was so honored to be part of their board and
Hmm.
accreditation chair for 5 years. I made a lot of enemies because I had to flunk a lot of people, but then I became president. But okay, I'm gonna say it. I was the only Gentile in the group.
Really?
Do you know what? Yeah, and I
Yeah.
was an A
Explain yourself.
besides that.
Explain yourself. Talk to me about that.
You don't know what a Gentile is?
No.
Okay, a Gentile is a non-Jewish person.
Oh, okay. I didn't
Yes,
know that.
yes,
Yeah.
yes, yeah, yes. So the real powerful guys in the groups, came from New York City, Washington D.C. They
Yeah.
were of Jewish religion, and I feel so thankful for them. George Freeman from Toronto. He was Montreal and Toronto now, and he and his wife Faye Ghost. They really embraced me. I became their brothers, and so I was not only the first Gentile, but I was the first Asian to fall into this leadership position.
Really?
So I'm
That's pretty
so
awesome, man.
honored.
Yeah, you're
Yeah.
carving the
So
way, right? I like that. That
I just 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 give them pineapples and lays every time you see them. Poke,
I think,
bring them
yeah,
poke.
poke. Go to Foodland right on the way to the airport and get your big thing of poke, right?
Macadamia nuts, just bring
Yeah,
macadamia chocolate covered Macs to them. But I'm so honored. So I say that in a very honorific way
yeah,
because I learned a lot. You know how it is when you practice, and this is a message for all dentists. We work in our little secure microcosms, our kingdom, so to speak.
yeah,
And when you go out and you get involved in organized dentistry, you meet people from all all walks of life.
yeah.
And being with my Jewish brothers, they taught me a lot. Like, Dan, you got too much aloha spirit. You got to be tough.
Yeah.
You can't be a yes person all your life. And I think being a yes person contributed to my burnout early on. So
Yeah.
so they trained me to be a little thick-skinned and to handle situations, yeah, uh,
Huh.
politically
Yeah.
and politically, yeah. So
I don't know, man.
I want to share.
I still see you as the nicest guy I know, man. You got a heart of gold, buddy. um, so when you were doing, all your training, and 40 years later, you look back at all the accomplishments and all the teaching you've done and the friends you've made and the patients you've helped. Do you ever wish you had a do-over? Like, would you go back and change something? I'm always so curious. I ask a lot of people this question because it really gets to the root of who we are. Like, do you wish
Yes,
you did something differently?
definitely, definitely. When I first started my practice, I was so insecure about money, about asking people for money,
Mm-hmm.
and I I just wanted to get the work done for these patients,
Mm.
and so I had very very loose financial uh, arrangements.
Like, what
Got
does that
stiff
mean?
quite a
Oh,
bit.
you got stiff
In
quite a
other
bit.
words, just like, oh, we'll bill you at the end of the month. You know,
Yeah.
it's like not even give us $20 and then pay us off. Within 3 months. So
Yeah.
just we'll bill you. Or the culture back then was, oh, just doc, just send me the bill.
Yeah. It's
Yeah.
how times
So
have
when I got
changed.
times have changed, especially well, see, when you do pediatric or restorative dentistry, your lab fees are relatively low. But
Right.
when you get into the world of aesthetics and implant dentistry,
Yeah, it adds up.
it adds up. And uh, so I became stricter. Now, how did as an insecure implantologist, this is how I handled it. Say the implant cost in those days is, this is the truth, but hypothetically, $800. Okay,
Yeah.
I would tell the patient, when I place the implants, I need to get paid $400, half, because we're not sure how your bone is going to
Right.
react to this. Okay, but in 3 months, when we check the implant to put a tooth on it or to snap your denture on it, you pay me the difference.
Yeah.
You pay me the difference. Okay, so now if a patient says, "Oh, like that's still too difficult for me," I tell them, "Pay me $100, but for the next 3 months, you need to have that balance paid off. So I've extended payment for like 90 days.
Yeah.
Yeah. And then, but I always let them know what the entire treatment plan is. Now, at the end of 3 months, you still need to pay for your teeth.
Yeah. Yeah.
And that's
Yeah.
this amount. And it's interesting, Nekky, because by then you've developed such a close relationship with your patient.
Yeah.
You know, the patients tell you, "Oh, I'm getting my tax returns, like in 4 months. I'll just pay you for the teeth."
Yeah. So you're
You know,
trying, like
it's
the personal relationship that you build with them allows you to
Mhm.
not get stiffed as much. Hey.
Yeah, yes, yes.
Yeah.
Of course, I never read the book, the the Road Less Travel. Do you know that one about this guy? This guy polled the United States, and he said 90% of the people that walk into your office will pay you as agreed upon.
Yeah.
Uh, the next 5% will pay you if you force them to pay
Yeah.
you. Then the last 5% will stiff you. They'll walk in with no idea how they're gonna pay you.
Yeah.
You know.
That's that is quite true. I hope I don't see those 5% too often, right?
Yeah. Well, you can screen them out quite easily.
Yeah.
Yeah. You can screen. Yeah.
No, I like that. I like, looking back, you wish you had more, you know, stricter financial policies. And because I think nowadays, especially with overhead rising, our dental supplies
Yes.
rising, inflation going through the roof, and our fees aren't really changing,
Hmm.
it's tough to run that practice. Have you found it tough, like, 20 years ago or 30 years ago to run your practice versus today? Like, what differences have you noticed?
I don't know. The last 20 years have been great because I'm doing what I want.
Okay,
You know.
okay.
Yeah. Yeah. I hardly
Yeah,
do fillings. At the
yeah,
most, I do a class one or small class two composite.
yeah,
You know, um, uh, on a existing amalgam, but it's mostly implants, implant prosthodontics. Uh, by the way, at one time I did a lot of third molars.
oh
Yeah,
yeah. Yeah,
yeah. About
that's my.
my,
I knew I
my
loved you.
20th year, I took a course from Carl Kerner.
Oh
He's from
yeah,
Salt Lake City.
yeah, yeah,
Carl,
yeah, yeah,
the GP, and I spent the weekend with them in Hawaii. So I learned to lay a proper flap,
yeah.
and um, so I got bolder on removing implants. Excuse me, removing
Remove
third
third molar.
molars.
I always tell people
Which ones?
if you get better at removing third molars, your implantology game goes through the roof because you get so
Yes,
comfortable working on teeth
yes,
and bone and flaps. So I
yes,
don't know. I'm a
exactly.
huge proponent doing third molars first and then getting into implants because I think it just opens the door.
Yeah,
Exactly.
it does.
Yeah. Now, I've stolen an hour of your time here and I've learned a lot. I'm enjoying myself. I love talking to you. But can you leave us with any words of wisdom that you feel us dentists need to hear? What do you want to tell us, man? Over your 40-year career, what do you wish you knew when you were 10 years out?
Well, I mentioned this earlier, Nekky.
Yeah.
Dentistry is a great profession.
Yeah.
It's a great profession. We are physicians of the mouth. Uh, if most of you don't know that dentistry was part of medical schools until like the year 1900. Then the dentists, like the podiatrists, said, "No, we want to make
Our
our
own
own
schools.
schools." Yeah, and we often forget that we are physicians of the mouth, physicians and surgeons of the mouth. If you be proud, be proud of who you are. You know, uh, you're not just a dentist.
Yeah.
You it's a great profession. If you think about it, running a 400,000 RPM instrument in the patient's mouth with a bird flying off and going down the patient's throat uh, is bad, is bad. Or even drilling, drilling in the mouth, running that handpiece. So everything we do in the mouth is uh, is risky. So
Right.
don't take your job lightly. Uh, the also dentists and physicians are the only professionals that can give shots to human beings and administer anesthetic. If you think
Hmm.
about it,
Yeah.
right? Yeah, yeah.
Huh.
My brother's an endocrinologist, and he had some stitches on his back. They took out a nevus, and he said, "Dan, can you take out my stitches?" And I said, "You're a doctor. You can do it." He goes,
Yeah.
"No, I don't. I just write prescriptions." you know, so I got up. I took out his stitches for him. He was
Yeah.
stoked. Yeah, but yeah, be proud of your your profession. Stand tall. Surround yourself with like-minded people. Continuing education. Thank goodness. We have institutes like Bites and Begin, Eugene Kim, and
Yeah.
John Kim. Great, great educators. The resources are there. We have these webinars. I can mention a few others, but I don't know them personally. I know John and Eugene
Yeah.
well, um, but yeah, the resources are there. Just smother yourself with uh, these these learning opportunities. When I spent a day with Eugene down in Buena Park, uh, he had about 20. It was a hands-on course on the lateral sinus graft,
Yeah.
and I just audited the course, and I had 5 dentists out of the 20 come up to me and say, "Dan, I don't want to sound like a stalker, but I watch for your posts every day, and I actually collect your posts and I read them. I go over them." I said, "Oh, that's cool, man. Yeah,
Yeah.
I like that." So my message in saying that is for young dentists, you know, join these forums, Bytes and PIA and OC Idea. There's some others because you can learn a lot,
You
and
really can.
you become you become acquaintances with these people. Um, Eventually, I really miss live meetings because
Yeah.
I just look so forward to going to like regional or AID, ICUI meetings and talking to the vendors and talking to my colleagues, talking to my Miss tribe. Carl always had a little program that you paid him $2,000 for a 5-hour lecture,
Yeah. Yeah. Yeah.
but
But you're part of the tribe.
try, be part of the tribe. And I'm so looking forward to coming up to Vancouver and
Yeah.
spending time with y'all up there.
Yeah.
I know you're in Calgary, but like you'll be there because I've made a lot of Facebook friends. The people I get a lot of feedback on is from Mark and Albert Louis.
Yep.
Yeah, Albert,
Yeah.
another OG. He
Yeah.
puts himself in my class. Not. Oh, sorry.
Are you all
I
right?
got excited, man. I caught it.
I love it.
I'm fast, man. I'm fast. Okay, but
Lightning
yeah,
reflexes.
he puts me. Yeah, he puts himself in my category of being an OG.
All right, all right, man. I,
Yeah,
I honestly, this hour flew by. I had such a great time. I feel like I learned a lot. And you're right. Stand proud, stand tall. We're not just dentists, and I think that's
yes,
the best message you can give someone because we all need to hear that sometimes. Because dentistry can be lonely, it can be difficult, but it can also be awesome. And the changes we can make
yeah.
in patients' lives are immeasurable. So, with that, thank you so much. I thank you for coming
I
on the
just want
show. Yeah,
I just want to add one thing. I
absolutely.
always believe that when you give a lecture
Yeah,
or some symposium or like is this called a webcast?
Sure.
What's this called? Yeah, a
This is
website.
just me talking to other dentists, man.
Yeah, this is not our our relationship, mine with you and with your members, whoever's watching, does not end today. It is the beginning of new friendships. So, with having said that, if you get any inquiries like, "Oh, how can I get in touch with Dan?" You know,
Yeah.
you can give them my cell number, or just tell them to go on Facebook and request to be a friend and something like. Because I really, I really enjoy connecting with my colleagues. And
Yeah. We
and
can tell.
thank
It's
you
just
again.
so authentic. I love it, man. You're such a great guy.
Thank you. You too, man.
Yeah.
You too.
No, it'll be awesome. I can't
Okay.
wait to finally come back to Hawaii after all this COVID stuff's over, and I'm gonna sneak into your office, and it'll be great, man. I can't wait to meet you in person, Dan.
Yes. In fact, Ho Young came to my office.
Yeah, he told me that.
Yes. Yeah, he popped. He says, "I'm on Maui, man." He says, "I got to come to your office." He came in, and we just spent like 15 minutes together. But
Yeah,
yeah, he's a cool guy. He's
yeah,
he's gifted. Yeah.
yeah. No,
So
totally. Thank you so much, Dan. I like you said, let's
thank
stay
you.
connected. And if anyone has any questions for Dan, like please reach out, and he'll definitely help you. It was an honor, and I hope to meet you in person soon. Thank you very much, Dan. See you later, my friend.
Thank you.
We'll,
Aloha. Okay.
we'll see you guys.
Bye.